Good morning. Welcome to our clinicians call this morning. My name is Rosa. I'm an LPN here at Two Rivers Public Health Department. So here's an overview of what we're going to be reviewing today. Where we are, mission and vision, that you'll meet our nursing team, ointment shortage, birth defects, flu view, influenza, and RSV. Have a couple of slides on COVID updates. I also have a HON and some information regarding salmonella contamination. And then I have a couple of slides regarding food recalls and also HIV and AIDS and measles. And we'll review a Nebraska wildfire that we had recently. Also, purple air monitors that TRPHD is putting on around our county, and human trafficking, and also a few tips for everyone on St. Patrick's Day, and also TRPHD website information. And I will give a few minutes to the audience to see if you have any questions. So where we are, Two Rivers Public Health Department does cover 7 counties, starting with Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. So our goal here at Two Rivers Public Health Department is a healthier community for all. Here is our information regarding our mission and our vision. The Two Rivers Public Health Department engages collaborative partners, community leaders, and the public to promote healthy lifestyles, provide preventative education, assure environmental quality, and create more healthy and safe communities for all who live within this district. Two Rivers Public Health Department envisions a health district where all are able to safely and actively live, learn, work, and play in their communities. Two Rivers Public Health Department facilitates partnerships and unique approaches that educate, empower, and engage local community partners, health providers, political decision makers, community leaders, and the public. Here's our nursing team, starting with Jackie Haley, BSN RN Nursing Section Manager. Jordan Anderson, BSN RN Community Health Nurse. Liz Wines, MS RN BSN Community Health Nurse. Marilyn Rankin, LPN Program Nurse. Rosa Pinon, LPN Program Nurse. That is me. Christy Cusick, BSN RN Community Health Nurse, and Brent Remick, who is our billing specialist and also schedules all of our mobile clinics. So we are currently having an ophthalmic erythromycin ointment shortage. So facilities in Nebraska who are anticipating a shortage should alert DHHS to their short supply status. It is currently recommended to administer to all newborns within 24 hours of birth to prevent ophthalmic neonatorium caused by Neisseria gonorrhea, which can result in severe and permanent damage, including blindness. Erythromycin 0.5 ophthalmic ointment is the only medication recommended for ocular prophylaxis. The American Academy of Pediatrics has issued guidance for alternatives, as you see below. You can currently order erythromycin ointment from a Canadian pharmacy, and that information is listed on the lower right-hand corner. March 3rd is World Birth Defect Day. Birth defect inequities consist of congenital anomalies, which cause 10% of all newborn deaths, 6% of all postneonatal deaths under 5, and 8% of all under 5 deaths. Survivors are at risk for lifelong disabilities. The goal is advancing access, successful advocacy, and capacity building strategies. A birth defect can be found before birth, at birth, or any time after birth. Most birth defects are found within the first year of life. Here's our flu view map. You can see in the lower right hand corner where we have the influenza season week 4 ending February 3rd of 2024. The larger map shows the 2023 to 2024 influenza season week 8 ending in February 24th of 2024. Here's our influenza and RSV in TRPHD region. So influenza B increased and was at a high level all through February in our district. RSV saw a decline, however, it was not very steady. And influenza A, as you can see with the turquoise line here, started escalating and then it kind of had a steady pace, and now it seems like it's starting to decline. Here's our information regarding influenza and RSV in Nebraska. So RSV started out pretty high on January 6th of 2024, and as you can see on 3/2 of 2024, there was a steady decline. Influenza A kind of was a little steady, then it kind of escalated there a little more around February 3rd of 2024, and it continued to escalate through to 24 of 24, and it seems like it is still on an upward trend on 3/2 of 2024. Influenza B started off a little low at 1/6 of 2024, and then it has a steady incline, so it's going higher and higher as we can see into 3/2 of 2024. So here you'll see a map regarding data regarding the United States COVID-19 hospital admissions. CDC data through February 24th of 2024 is listed. COVID-19 hospital admissions were 17,310 from February 18th of 2024 through February 24th of 2024. The percentage change in COVID-19 hospital admissions at a decrease of 10.3% from January 6th of 2024 to February 17th of 2024. This slide goes over COVID vaccines, new CDC guidelines for 65 and older. The summary of recent changes was last updated March the 1st of 2024. All people aged 65 and older should receive one additional dose of any updated 2023 to 2024 formula COVID-19 vaccine. Updated information for reporting adverse events to VAERS following administration of COVID-19 is still recommended. The following is a list of COVID-19 vaccines that are available in the U.S. Spikevax, Comirnaty, and Novavax. Therefore, the original monovalent and bivalent formulas should no longer be used. The following is COVID-19 isolation guidance. The previous COVID-19 guidance recommended for healthcare professionals still stands. There's a minimum isolation period of 5 days plus a period of post-isolation precautions. CDC offers separate specific guidance for healthcare settings such as COVID-19 and flu. On your lower right-hand corner, you can see there is a link that can give you more details in regards to this information if you have any questions. Here's COVID-19 isolation guidance regarding updated respiratory virus guidance recommendations for non-medical personnel. Step 1, stay at home as much as possible, at least 24 hours after both number 1, your symptoms are getting better overall, and number 2, you have not had a fever and are not using fever-reducing medication. Note that the guidance does not end with staying home and away from others when sick. Step 2, resume normal activities and use additional prevention strategies. Taking more steps for cleaner air, enhancing hygiene practices, wearing a well-fitting mask, keeping the distance from others, and or getting testing for respiratory viruses. So depending on the length of symptoms, this period could be shorter or the same or longer. There is a link provided for you, which you can go to that will give you further details. The FSIS issued public health alert regarding natural life ready-to-eat chicken meal products due to misleading and undeclared allergen. The component contains egg white, a known allergen which is not declared on the product label. A recall was not requested because the affected product is no longer available for purchases. There's currently a multi-state outbreak of salmonella. Salmonella can cause salmonellosis, which is one of the most common bacterial foodborne illnesses. Charcuteria meat products ready to eat were recalled due to salmonella. The signs and symptoms are diarrhea, abdominal pain, and fever. The typical onset is 6 hours to 6 days after consuming the product. So check your refrigerators and make sure that you do not have this product at home. And if you do, then you should get rid of it as soon as possible. There's currently an FDA alert regarding high lead levels in ground cinnamon products. We encourage healthcare providers to raise awareness among patients about these products, encourage parents to immediately stop using the product, throw them away, and not buy these ground cinnamon products, and also consider testing the children for lead exposure from these and other sources. There is a link below that has further information. Trader Joe's chicken soup dumpling recall. Consumers reported they found hard plastic in Trader Joe's steamed chicken soup dumplings, recalling approximately 61,839 pounds of steamed chicken soup dumpling products. There have been no confirmed reports of adverse reactions or injuries due to consuming these products. Anyone concerned about an injury should contact a healthcare provider immediately. The FSIS urges you to check your freezer. If you have these products, you should throw them away or return them to the place of purchase immediately. There is a link provided for you that gives you more details in regards to this product. So here is where you can go to find more information regarding the USDA recalls and public health alerts, also FDA recalls for market withdrawals, and also safety alerts. We wanted to go over women and girls HIV/AIDS awareness. AIDS is acquired immune deficiency syndrome, which is a medical condition in which the immune system is too weak to fight infections. HIV is a human immunodeficiency virus, which is a virus which alters the immune system in humans. Most people with HIV do not develop AIDS because taking HIV medication as prescribed stops the progress of the disease. So knowing your HIV status puts the power in your hands, which is what we're trying to do at this point, because there are 83% women that contact HIV through heterosexual contact, 16% inject drug use, and 1% get it in other ways. I have provided a link below which gives you further information in detail regarding women and girls HIV and AIDS awareness. So in regards to measles, we wanted to provide some clinical guidance for suspected measles cases. Measles resources for clinicians, as they said it's not a matter of it, but it's a matter of when it's going to get to Nebraska. Staff should prepare for patients presented with suspected or confirmed measles. Unannounced suspected measles patients, patient screening, transmission, signage for exam room closure, and most of all, the focus is on patient safety and safety of others. The link below will go over in detail regarding all of this information. On February 26th of 2024, there was a wildfire in central Nebraska. Governor Jim approved a state disaster which allowed funds from the government's emergency fund to be used for assistance in the response. Donations can be directed to the local Salvation Army if you would like to donate. An initial damage assessment showed that Betty's Way fire destroyed 4 primary residences and damaged countless outbuildings and agriculture infrastructures. No injuries or fatalities have been reported. Two National Guard UH-60 Black Hawks helicopters were also deployed to the fire to drop water on the fire on February the 24th of 2024. If you were impacted by the fire, please contact the United States Department of Agriculture or the Natural Resource Conservation Service, the Salvation Army, or the American Red Cross. The numbers have been provided for you on our slide. Our environmental health team is measuring the air quality, so there are purple air monitors that have been placed. The new monitors obtain and measure the levels of particles matter PM between zero point 0.3 and 10 microns in the air. Common contributors in Nebraska include wildfire smoke, agriculture, and also dust storms. For further information, you can look it up in the link provided for you on our slide. I wanted to provide you with some information regarding human trafficking. As a nurse, whenever you see a patient, typically you see them, and the first thing that comes to mind is what is their complaint. But I do believe that most of the time we oversee who is around them, how they're acting, if they have specific tattoos that we've seen on other patients that have recently come to our office or to our clinic. So I did want to go over some of that information because nurses should be more aware. There are less than 1% of nurses that actually report that they are confident in identifying red flags. So I wanted to provide some of that information for you. So, human trafficking is a form of modern day slavery that involves children, teens, men, and women that are subjected to force, fraud, or coercion, commercial sex, debt, bondage, or involuntary labor. Some signs and symptoms could be physical bruising, limited eye contact, unexplained injuries, prolonged infections, STIs, ectopic pregnancies, substance abuse, near overdose, broken teeth, branding tattoos, also such as dollar signs. There are 27.6 million victims worldwide. In 2021, Nebraska recorded 57 cases from 240 tips from 107 victims and survivors. There is a hotline that has received 1,927 signs. Of those, 479 cases were identified, 1,034 victims were identified. 88% of victims had healthcare contact and were not reported while being trafficked. That was very surprising to me. I did provide a link below which gives you further information and details regarding human trafficking. March 17th is St. Patrick's Day. It started in 1631 when the church established a feast day honoring St. Patrick, one of Ireland's patron saints. So here's some information regarding drinking and driving. The key is prevention, as we all know. So making good decisions and planning ahead can save somebody else's life and also your life. So always choose a non-drinking designated driver. If you go out alone, do not drink alcohol. Order a non-alcoholic beverage such as a soft drink or water. Never feel pressure to drink alcohol. If you do plan on drinking, do so responsibly. So eat plenty of food and drink water. If you've been drinking, call a taxi or an Uber. Never get into a car with a driver who has been drinking. If you can safely do so, protect others from taking their keys. That is part of being a friend and being safe. If you would like to join our clinicians call, you can visit trphd.ne.gov and go to the monthly clinicians call, and you can join us and you can see all the up-to-date information that we are providing for everyone in our jurisdiction. Here is our community events calendar that goes over our clinics for the month of March of 2024. So please call our office to schedule an appointment at 888-669-7154 if you have any questions or interested in signing up for any of our clinics. Thank you for your time and thank you for joining us. If you have any questions, please email our nursing section manager, Jackie Haley, at jhaley@trphd.ne.gov. And have a good day.